Sego, Nyawagoa, Wabano.
Atilo kanot tunga sa katakasita mga kaigo si tunga sa katanga sa kasi. Welcome to Wabano.
Bonjour, Bindigen, Indi, Wabano Centre.
Ani, Tansi, Sego, Tangasuving, and welcome. Welcome to the Wabano Centre for Aboriginal Health. Wabano means a place of new beginnings. So when a person walks through the door, our hope is that they will feel that this is where their journey, part of their journey, will begin. That it is a place of belonging. It is a trusting place. It is a safe place. It is an accessible place. The things around them are theirs. They recognize them. And I think that's very important when people are seeking help, that they have a sense that it is their place.
You can put the medicine wheel on a flip chart. You can fill in each section of that medicine wheel. But that's only for visual aid. When you're around people and you hear that, when you know it's good, when you know it's right, when you know it's who you are, it goes into your heart and it stays there. And in your job, in your role, it comes out because it's your belief.
In my language, we would say Mino Bebotsuin, which is the good life. We are seeking that good life, and that is an everyday journey in our lives. It's about the mental, the emotional, the physical, and the spiritual aspects of well-being of that individual's journey. And each day, that is what our team works on. It is about maintaining the harmony and the balance of that individual.
Hey, ya, ha, oh, hi, oh, hey, ya, ha, oh, hi.
Mental health issues are very demanding in Aboriginal communities. And Wabano is unique because we offer a spiritual and cultural component. We bring in elders who share their teachings and wisdom. We bring in regalia making. We have a cultural reclamation program to help people who have been disconnected from culture.
For us, culture is the pillar of this organization. So there's nothing that we can engage in without providing a sense of identity, a place of belonging. A person must know their culture, must be surrounded by it in order to begin their journey, to know what that is, to walk that good life each day.
It's just amazing to see how people take a place of belonging when they go through a cultural experience, a cedar bath or a spiritual ceremony. Just connect and get a sense of belonging and connection with people. And the other piece to that is building relationships, is that we help people rebuild connection to family, first of all reconnection to self, and then reconnection to family, and then connection to community.
Hey,
I get tired of burying my people, and I figured if I can give back and hopefully save some lives. And we have had since this program started, we have had 27 deaths since 2001, and most of them were preventable. Other than the clinic, we're the largest program within Wabano. It helps Wabano within the Native community, not just to get the word out, but to help people, those who can't or won't access primary health by going to clinics. So we have to go to where they are. This is our nurse practitioner. Down treating our client down there also is our mental health worker and our youth worker. We have our grandmother, our program grandmother, she provides cultural support to our clients. Once we get them on a stable grounding, then they'll be able to access Wabano services on Montreal Road.
Hey,
We have a healing lodge beside the primary care on the main level of this center. That in itself is a reminder to our doctors and nurse practitioners that the integration of what it is that they do is only part of what that individual actually needs. You cannot just provide singularly the physical piece, the high quality primary health care that in fact we all provide here. You must understand that there has to be something that links into the family, and the family must be engaged in this process, and that the greater community is also part of that person's journey. And the two, there will be wellness. When a person is healthy, your community is also healthy. They go hand in hand. So the programs that we provide here link into celebrating our community, celebrating our families, and celebrating that individual within all of that context.
A person's a human being, and if you only direct your focus on one small aspect of that individual, in my view, you're not providing the right services. You have to get to know that individual. You have to know that, you have to make sure that individual understands that you care, that there is an emotional investment in this person in front of you. And that when you refer this person, that emotional care is going to be there also. I would like to think that people walking into Wabano, when they walk into the front desk, they're seeing that, they're given that.
We see the results every day. We see the value, we see the rightness, and we see the truth of the work that we do every day.
Our doors are always open, and we extend an invitation for you to come down and just to learn about what it is to walk the medicine wheel. Nyawa.
Oh,